Water use considerations for labor and birth. Legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only. Content is not intended to substitute for professional, legal, or clinical advice. We try to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your local unique situation. Course objectives: the students will be able to verbalize the importance of knowing when water use during labor and birth is appropriate and a person is a good candidate for it. You'll be able to talk about the basics of what is water birth, what is the history of it, things to consider with the different birth settings when we're talking home, birth center, hospital setting, various supplies and things to consider when you're doing water therapy during labor and birth, and then the risk and benefits of water birth and who are good candidates, and to verbalize when you would consider getting people in and out of the tub and things to monitor as a midwife. So this topic is really important because it's a very powerful pain management tool used all over the world. It has a deep, water and birth are very deeply connected, and it is fascinating to see when the baby is floating in the water for 9 months, it goes from coming into the world from the mom from water to water. It's a very gentle transition. There's a lot of myths, there's a lot of misunderstandings, there's a lot of lack of training, especially in the traditional medical world around water births, and we're trying to get more and more education so that there are choices and options, and skilled care providers are what makes these choices safe. A lot of the bad outcomes that are noted with water births have to do with improper infectious control protocols between patients, the lack of training with the care providers, a lot of not understanding who's a good candidate, who's not. So we're going to dive deep into the power of water and how it can support your patients. So let's get to the basics. What is water birth? Water birth, water immersion, is the use of water, whether traditionally we think of a tub. I mean, you can use shower and immersion into the water therapy, but mostly we're going to focus on using their either an inflatable tub, their home tub, a water birth tub at a birth center or a hospital. There's tubs very specifically designed. The biggest thing is you want enough depth and angle so that when the baby is delivered, and it'll give the pain relief, you want, most standard tubs are 16 to 18 inches deep, and a true water birth tub that gives you the most pain relief from the studies are really at least 22 to 26 inches deep, but it depends on how tall the patient is too. If you have a shorter patient, they don't need as much water to submerge themselves in. But the goal is to get the hips and the belly and everything to be taken away from gravity and just have that relaxing, calming, warm environment to be around. The process of water birth, whether you're choosing it at home, birth center, hospital, you have to consider, do you have to pay for it? If it's at home, it's a little easier. You can get an inflatable tub. They could use their home tub if it's right size. The midwife care providers have to make sure it's a safety, easy to access. If there's a shoulder dystocia, get them in and out of the water easily. If there's some postpartum hemorrhage, these are things that we, when we're considering the use of water during labor and birth, we have to think about what supplies are there. If you're doing a inflatable tub and draining it with a hose, having a pump. I've learned the hard way doing water births in basements and not having a pump, and then having to hand take with buckets the water out of their basement. So please learn from my mistakes. But you have to think about, even if you're in the hospital setting, what are the policies, what are the protocols? Some hospitals, based on risk management, only do labor therapy for pain, but they won't do it during the actual birth, and then you have to go through extensive risk management meetings if there accidentally is a birth in the water. So you have to know your setting, you have to know your protocols, your standards, and what does the mom want? Maybe she doesn't want to deliver the water, maybe she really does. Is it on her birth preferences list? But there is so much data that shows the power of water therapy, and honestly, on my community-based births in the home and birth center setting, 90% of the ladies delivered in the water. It just felt so much better. Once they got in the water, they didn't want to get back out. So you got to think about the temperature of the water. We wanted about her body temperature, 97 to 100. I'm checking the tub temperature every half hour, just depending on how warm or cool the room is. considering if you're at their house, how big their water heater is. If you're at a birth center, you should have installed a really big water heater, just like in a hospital setting, so you don't worry about running out of hot water. What are the supplies you need to clean, heat, maintain the pool temperature, the cleanliness? Are you lining the tub, if it's inflatable and multiple uses, with plastic? There's a lot of great companies out there, Water Birth International. There's a lot of, like, In His Hands Midwifery. They have water birth supplies specifically designed for the midwives to use multiple times and home use one time. So you just need to kind of figure out, fishnets are really important to have for scooping out any remains in the pool. The history of water birth is really, really fascinating. It originated from among the Maori, the Indians of South America, and even the ancient Greeks and Egyptians had practiced water birth. So 1805 was the first accounts of water use during labor and birth in Europe. The history of water birth, the pioneers in the 1960s have a Russian researcher, Igor Chazvatsky, had looked into it a lot. There were the use of large aquariums and glass tanks in his home in Moscow that mothers would give birth to in. He experimented with babies being born in cold versus warmer water. His thinking was to help protect the brain and enhance the cognitive abilities, but they're now finding if they're born in water that's too cool, you have that risk of the nerves, the reflexes in the cheek being stimulated and them breathing before they come out of the water. So a lot of it is theoretical. I don't know if there's a lot of documented cases of these bad outcomes. It's a newer territory. It's an ancient art of midwifery, but it's not one that the mainstream hospital system likes to research and do documented expansion on. The 1970s, midwives and doctors in France became interested in the different ways to transition the baby out as smooth as possible using warm water. If you look at the physiological birth practices and a lot of the recommended standards for twins, like even in Europe, they recommend doing a water birth to help with reducing the risk and interventions. So um, there's a lot of things to consider with water birth for pain management and for your patients, who's a good candidate, which setting you're delivering in. Um, the benefits to water birth are extensive. They become very, very popular. I know ACOG does not recognize the benefits. It's hard when it's a conflict of interest between different business entities. Doctors do not rarely, that's rare that they do water births. It's a hallmark of midwives. And so there is that tension and opposition of some of these therapies and pain managements, especially the alternative ones. ACOG and the mainstream traditional hospital healthcare system don't recognize, don't recommend, versus midwives and ancient wisdom have different positions. Other benefits for midwives: it shortens the birth time, it decreases the risk of tears, it's a gentler bonding transition for the mom and baby, decreased pain perception, decreased need for epidurals and spinal pain relief. It creates a more home-like environment, calmed, not so many medical interventions, more empowerment to the woman. She can change positions easily. The stirrups in the bed make them more vulnerable to care providers. She has more of the power over her body and choices. Thinking about the pools, thinking about the setting, there's so much to consider with the benefits of water. You just have to be comfortable and trained to be able to do water births. And you got to have an art. Like, if you put them in the water too soon, it can stall out the labor. But if that was your goal to do that because she's had a long prodromal early labor and you want the contractions to relax and go away, the water immersion is a great thing to use in that early first stage. If you have a mom that's had babies before, I love sticking them in the water because it will either, if she's close to that active labor, it'll help her relax and get into good hard labor and transition things faster. So there is an art and a timing to getting in the water and filling the tub fast enough. I've had ladies that go so fast in transition and there's barely any water in the tub and she's wanting to deliver in there. So you have to have an art and a planning of how you're going to inflate the tub at home. If it's a birth center, how fast the flow of the water is. At the hospital, what are the policies, protocols, and things to consider there. Warm water, whether it's a warm washcloth, whether it's a shower, whether you're immersing yourself directly into a tub, all have immense benefits to moms and babies for the labor process. You obviously want to consider the candidates that are good and not so great to consider the water for. So ACOG recommends doing it during term normal healthy deliveries as the same as midwives and most other cons- um, organizations. You want to consider, okay, what are low risk? And this is subjective across the country, but there are some consistent guidelines. Some organizations will say head down, but then you look with Breach Without Borders and a lot of these education, especially in Europe and internationally, twins, breech presentation, long labors, significant third and fourth degree tears, water use for labor and birth is actually recommended. The clear amniotic fluid, it's hard if it's thin meconium, it's not a big deal, but if it's thick meconium, the baby will probably be already a higher chance of being stressed when it comes out. And so you want to have the newborn resuscitation resources and things close by that may or may not be available to do easily with the tub, depending on where it's located. You got to also think about why are we using water? What is the purpose of it? What's the temperature? Um, does it have an accessibility where a support person can get in the water and do rubbing? How easily can they move in the water? How great of a sense of control? I've had ladies the opposite direction. They get in the tub and they feel overwhelmed and it trigger things. Worst you do is you just get them right back out. I've had it where ladies want to get in the water and it stalls out their labor. We make them walk on some steps for a while and then they can get back into it. So you can customize. There's no hard rules. I don't think there's any rules of keeping them in too long as the temperature doesn't get too hot or too cool on the tub. I've had ladies where I'm like, okay, it's time to get up to the bathroom. And she's like, I don't want to get out of the water. And they'll just void into the tub. And so you just have to adjust your customization to the families you're taking care of. So there are things to consider: early babies, post dates, infections, poor quality measures, like if the water hasn't been inspected. Home births are a little harder because you just don't have as much you can do with quality, but the families have more of the risk and accountability of the choices they're making. So birth centers and hospital facilities have to have a very different quality standards, expectations, facility, water inspections, cleaning, training for their staff than home births do. History of shoulder dystocia is fascinating to me because some of the guidelines will say it's actually an indication with hands and knees and water birth to do a shoulder dystocia history in the water, and some don't. So you kind of have to look at the data and research that's out there. Obviously, if she's sedated, has an epidural, she can't move, she's not using the right state of her mind, she could slip and fall. If she's bleeding during labor, we need to do some continuous heart monitoring of the baby. There are some hospital facilities that they have continuous telemetry that's on a wireless based system like a Noel, but most facilities, if they have to be on continuous monitoring, there's a medical reason for that, and you probably wouldn't be considering a water birth for them. Other things to be considering is just like the infection component side. It's extremely rare, but Legionnaire's disease, inhaling of water that has the Legionella bacteria. That's why it's important with policies, protocols, water testing, to make sure that you're choosing a safe setting and safe supplies to use. There are rare and severe fatal diseases that can cause coughing, pneumonia, and other issues that will get compounded by doing a water birth. So you need to consider, are you having trouble regulating the baby's temperature? You're having trouble regulating the water temperature. Maybe you know this baby has a short cord from the ultrasounds. You may not be considering a water birth for this client because when you take the baby out of the mom, you're not going to have enough cord to bring them above the water. Draining a tub fast is very easy to do with hospital and birth center tubs, not so much with home birth inflatable tubs. Obviously, there's a risk of respiratory distress for the baby. Once the baby comes up in the air and takes their first breath, it's really important that you keep the baby above the water. It seems obvious and silly, but you got to remember that birth providers are tired, exhausted. It's 2 in the morning, 5 in the morning. They've been up a long time. The lights are dimmed. The mom is tired. I usually start draining the tub pretty low to her belly button once the baby comes out, and then just putting warm blankets on the mom and baby. But it just depends on the situation and where you're at. If you know she had a fast labor, she's orientated, well alert, and her arms are strong, like I'm more laid back with her holding her baby and making sure the baby stays above the water. So water birth, the cost can vary greatly. If they obviously have to buy the tub to use at home, if they want to do a water birth and it's only available in a birth center home setting, there's a cost, especially if insurance doesn't cover it. You have to consider I've had lots and lots of ladies choose strictly a home birth, a birth center, because they wanted a water birth. They wanted as many visitors as possible. And if your insurance doesn't cover it, that's the cost that you're paying for the midwifery care and the tub. What are the supplies that you need? Some midwives will have bundled packages of supplies and a rental tub. Sometimes the moms want to buy it themselves. And then there's a a high wall fish pool on Amazon people will get, and then they just keep it and let their kids play in it afterwards. So there's a lot of variations. If you want a professional grade tub, you're going to pay more for it. The Amazon tub, last time I checked, it was like $80 versus like the professional ones on the official websites are closer to $300 to $400. Obviously, if it's a birth center or a hospital facility, they're going to pay 5, 10, $30,000 for that tub, depending on how big and complex that they want to get it installed. And I think we just already talked about this, but yeah, it varies greatly, just the prices. So I would say it can go on the low end from $80 all the way up to, if a tub has to be installed, 20, 30,000. Other supplies to consider, it's not just the tub. You want, if you're doing a water birth at home and it's not easy to drain, you got to have a hose, you got to have a pump, you need bleach for cleaning in all settings, whether it's birth center, hospital, home, adapters for the sink. If it's in a home setting, you need lots of towels, preferably warm towels, thermometers. The salt is can be used. Some people will put it in for the achiness, and other places will recommend not to put any salts or oils or anything in the water. So you just have to do your research and decide. A tarp to protect the floor, a plastic sheet to cover the tub if multiple people are going to use it, and then another plastic sheet to cover the top of it with a blanket so they can keep the heat in if the mom's not going to use it right away. If you're in the home setting and they have a smaller water tank, you're going to have to consider pots for boiling water or backup options to keep, especially because a lot of these tubs are 80 to 120 gallons, and the average home water heater is like 50 to 60 gallons. How easy is it to access the water tank? I always have mixed feelings about telling parents and home births to increase the water tank temperature, just because the risk with their other kiddos before the birth of getting burned. So we usually put it on that early labor checklist. If like the other kids aren't home, we don't have to worry about them using the water. I'll put for the partner, the dad, hey, you're gonna get snacks, you're gonna get the tub ready, put some real hot water and it will cover it. We can always cool it really easily. It's just hard to get it warmed back up fast. So there's certain things that can be done to help with that. So these are things to consider, and there's a lot of controversy and a lot of data that's not there. So just consider low risk candidates. If they're good for an out of hospital birth, they're probably good for a water birth. But in the hospital setting, there's a lot of sick people, hypertension, diabetes. VBAC is even controversial about water births just because of, in the hospital setting, continuous monitoring and extra interventions versus out of hospital. Multiple births, breech presentation. It's fascinating because some guidelines it's recommended to use water birth for the management and improve outcomes, and then some it's contraindicated depending on what organization and what country you live in around the world. Preterm labor is a pretty consistent one, not recommended, because there's a wide range of gestational age. Even if you're thinking this kid is 34, 35 weeks, it could be 31, it could be 37. You don't need any extra respiratory distress on a baby because of the water and the temperature plus resuscitation risks. So there's certain low risk healthy women most likely can also do it. So you want to just consider the tub, you want to consider the care provider, you want to consider the setting, you want to consider the education of the patient. Informed consent is always important. Is the baby breech, multiples, term pregnancy, is the water broken, fluid, how has the heart tones been looking, how are the vitals, how has the labor and the pregnancy been doing? You just have to use, if they're low risk healthy candidate for a community-based birth, they're probably a candidate for a water birth. These are just some recommended suggestions to consider, but you would have to decide on your policies, protocols, what would be best. So just as an overall conclusion, water birth is an amazing option for pain relief during pregnancy, during birth, labor, postpartum, sitz baths, baby bonding. The list can go on of the power of water use during the perinatal period in general. It's used all over the world. It's got a lot of history to it. There's so many benefits, deep in culture, deep in empowerment of women and bonding and a peaceful transition. There's a lot of world-renowned hospitals, big and small, that use water birth for their moms. Most of the United States, it's not so much about a safety issue. It's about the obstetricians aren't trained, don't want to do it, and risk management with the hospital perceives it as a safety issue and it is not allowed. So there are far and few between with hospital settings, but mostly water birth, water use for therapy has to do with a community setting. So you definitely need to make sure you're skilled, you've got good policies, you've got a protocol for good candidates, and have a good discussion. And there's a lot of great benefits to water therapy